Hey everybody. So you may have noticed if you're quick that I just uploaded a video, except halfway through I turned my phone upside down, not knowing that it would turn my video upside down because I'm apparently 100 years old and don't know how technology works. So it messed up the sound. Anyway, it was ridiculous. So I'm going to attempt to re-record this, but I'm sorry if I forget some things. Okay, so in 2 days I will be 6 weeks post-op. Let's see what we got. Okay, so the left side is good. I like it. This was like my puffier side. And I guess it still is. You can kind of tell. I guess if you look at it that way, never mind, I don't care. Anyway, it is a little bit, because of right where the incision is, it's kind of raised and it makes everything stick out, but it's not so bad. And you can see there's a little bit of definition here. You can see it better in a different light or whatever, but I swear it's there. And this nipple's pretty much good. There is still a little bit of stitches in there that I can feel or see sometimes. My doctor or the nurses told me to just kind of trim the ends of it. On this side, I messed with it too much and it got annoyed, so it kind of looks like a pimple. So that's fun. There's one tiny piece of scab left, and there's a little bit of stitches in there, just a little bit. The tape I'm using is called, I think it's called Medipack, and it's silicone, and it's $15 on Amazon, and it's pretty great. So here's one of my incisions, a little bit. There's a little bit of, I guess, stitches here. There's some here too. The doctor just said to leave them alone, and wow. That looks pretty good. I've only had this tape on overnight. Yeah. So I'll make a video without it in a couple days to see where we're at. Yeah, this stuff is really great. It's really easy to put on because it's in a roll. It's sold in a roll of tape, and then you just kind of shoot and then cut it and put it on. Or put it on and then cut it, whatever. I like it better than the scar strips. They were kind of challenging to work with and got really dirty and gross. Anyway, I'm really content. I'm still putting Vaseline and gauze, just a very one single thin layer, and I tape it on. They said I could use Vaseline and a Band-Aid, but Band-Aids really super irritate my skin, and the first time I used Band-Aids it was very painful, so I'm just using gauze and the medical tape, and that works okay, and that's just because I have still some stitches and some scabs and this crazy thing. One thing that grosses me out is that I have to massage it, and it really makes me want to throw up, because I can feel all the scar tissue underneath and it just creeps me out, but apparently that's what you gotta do. Also, I need to be compressing for 3 months, and they said that I can use, so when you sit up like that sometimes, it feels right here, it feels like I pulled a muscle, but it's not, it's just that's the only thing that ever really hurts significantly, is that feeling of pulling a muscle, and I don't like it very much. But the nurses don't seem concerned. I emailed her 7 times with all my questions. She's just it's fine. But yeah, now that I'm just healing and nothing really major is happening. I'm like, oh my god, something's wrong, but nothing's wrong. Anyway, I have to use compression for 3 months. So I'm like halfway done. And I've been using an ace bandage, and I keep trying to find like Under Armour type shirts that are a little bit small, so they provide compression, but I can't find any that fit me. I even use like a kid's size extra large or whatever, and it's like tight here, but it's not tight here, and it just doesn't feel as tight. And I like the ace bandages better because I can control how tight they are. But I do use the ace bandage over like a tank top or a thin t-shirt, because otherwise it slips. It like starts to slip down really easily. So that's what I'm doing for now. That's probably what I'll keep doing for the next 6 weeks. I can start running this weekend. This weekend, and I can start stretching. My range of motion's pretty good. There are some things that still hurt a little bit. They're like, not that they hurt, but they're like a little bit tight, but I can pretty much do everything I need to do. I can't carry, I'm not allowed to lift or use these muscles too much. She said at 8 weeks I can lift 30 pounds. But I'm excited to start running this weekend. And then, at 8 weeks I can do other kinds of exercise. I'm sure there's other kinds of exercise I can do at 6 weeks. But the only things I really do are running, swimming, and a little bit of climbing. Swimming and climbing I definitely can't do for at least 8 weeks, but they did say probably closer to 10 or 12, which is fine. I don't want to, because I know how rough that could be on all this. One thing that I really like is, sorry, my computer keeps unplugging. One thing that I really like is they did some lipo. Can you see my scar? It's like a little scabby right there. They did some liposuction. They said lateral, so I assume it was just here. I don't know if it was like anywhere else, but they did it here, and you can tell. Like, I noticed it the other day that like I can tell here. It looks pretty cool. Very masculine. Makes me feel like I have muscles. I do. That's the other thing I'm excited about, is that I, even before surgery, like if I worked out consistently, I would pretty quickly like build muscle that you could see, like even this. But I would like build chest muscles that you can actually see. And I build muscle here pretty easily too. So I'm excited to have it actually, that I can show it to someone other than my partner. So that's pretty much all I got. If you have any questions, please ask them. I had surgery in Plano, Texas with Dr. Peter Raphael, and it was perfect, basically, like the perfect facility to go get your surgery done if you are in the area. And then, I go back in April, I think at maybe that'll be about 12 weeks, 3 to 4 months post-op. Because I said that, because I can't go for my 6 months because I'm going to be moving out of town. I don't know if they do a year, but if they do a year, I'll probably be able to come back, but I just can't make it for the 6 months because I'm moving in May. But, out of town, moving out of state. But anyway, so I'm going in April, and they'll tell me how everything's looking, and I'm very happy, even though there's so many things that I'm stressed out about. Okay, thanks for watching. Bye.